Hello, Dr. Ruella. Thank you so much for joining us on MD Newsline podcast. Can you please introduce yourself to our audience?
Absolutely. Thank you for having me. Marco Ruella, I'm an associate professor of medicine at the University of Pennsylvania. I'm also the scientific director of the lymphoma program there. I'm a physician scientist. I see patients with hematological malignancies, and I run a research lab interested in T cell immunotherapies for hematological malignancies.
hmm And you were involved with some interesting presentations here at the conference. So, can you tell me a little bit first about the panel the talk that you moderated, specifically, I think about host factors when it comes to these topics. Tell me a little bit about what that talk was about.
We organized a session that was part of the ASH program as a scientific workshop. and It was entitled, again, as you mentioned, Host Factors in Cancer Immunotherapy. And so this was organized within the Committee for Emerging Cell and Gene Therapies. It's a committee of the ASH, of the American Society of Hematology. And I co-chaired this session with Dr. Marina Cavazzana from Paris. And so the idea that we had was to try to think a little bit about out of the box about what are factors that we typically don't consider that can affect cancer immunotherapy. And so we thought about host factors because typically these are the ones that we don't really either measure or focus on when we look at our trials and our retrospective studies. And so we talked about, for example, the impact of sex on cancer immunotherapy, the impact of exercise, obesity, aging, inflammation. So all these sort of host factors that diet that might be having an impact on our therapies.
hmm And just from your vantage point as a moderator, were there any unifying themes or messages that emerged across the different presentations?
Yeah, that's a great point. Definitely. I mean, first of all, these factors do have an impact. Just to give you some example, males and females do have different outcomes in cancer immunotherapy, or obese patients and non-obese patients might have different outcomes. Exercise, likewise. So they are all sort of interconnected because you might imagine that if you are obese, probably you're having less exercise, and you might have a different diet, and so definitely they have an impact. Definitely they affect each other's. And I think what we learn is that we can actually potentially manipulate and modulate these factors to improve the chances of a response in our patients.
hmm Interesting. And how do you think the session advances the field's understanding of why only a subset of patients derive durable benefit from cancer immunotherapies?
So I think that this was a pretty unique session because, again, try to shift the focus, at least to add to the focus of the conference, also this concept of the host factors. And so I think that's how I think is going to advance the field, by bringing people together and say, well, we should probably think about also these factors. For example, when we were organizing the session, we invited speakers that were potentially not coming to ASH because historically they are not part of the community. They don't focus necessarily only on hematology, and so we brought them together and basically asked them, can you tell us about your research and how this research can affect also our patients?